Hi, my name is Paul. I'm a nursing student, Indiana Wesleyan, and this is my head to toe. Before I get started on my head to toe, I'm going to provide privacy and pull a curtain if this was an exam room, and now I'm going to wash my hands. I'm going to sanitize them before we get started. As he walked in, I'm trying to get the camera. As he walked in, I did notice that he walked in with a steady and smooth gait, no deformities, no abnormalities, no assistive devices being used, and no involuntary movements. He did come in, he got on the table, he's sitting upright, and his position is erect. That tells me his muscles are working very appropriately for his age and, developmental status. When he did come in, he is dressed for the season, shorts and shirt. It is about 65 degrees outside today. He is clean looking, so good hygiene is also noted. Also, when I look at his, just from naked eye view, I look at his skin. It is pink in color, warm to touch, and his mood and affect seem pleasant and cooperative. Can you repeat after me? The sun is bright.
The sun is bright.
I see a red roof.
I see a red roof.
I did that just to hear you talk, so I can understand your speech. There's no problems with your speech. You're very articulate. Your nature, your content is appropriate, and you have no speech impediments or any kind of speech, issues in history or past.
No.
Okay. And moving on, when I look at your face, I see all your facial features are symmetrical and evenly distributed, and you have no signs of concern just from the naked eye view, and that's cranial nerve number 7. Also, your nutritional status, he told me before he came in here he weighs about 280. With that being said, your nutrition is good.
Yeah.
Okay. He is a little bit over his ideal body weight, but he is healthy and he has no chief complaints. He's not being treated for anything and has no chronic illnesses at this time. The other thing, why we're here, I'm just going to go ahead and do this. It's a little ahead of time, but checking his skin turgor. His skin turgor is normal. No signs of dehydration. Sometimes if you're dehydrated, your skin will stand on end. When you pinch it, it will stand there and take a minute to relax. And so with that all being said, I think we're going to move on to the next phase.
Okay.
Next phase is your head, face, and hands. Again, when I look at you, you look very normal to me. You seem to be okay, no pain, tenderness, or anything like that.
No.
And as we go through this assessment, I want you to let me know if there's ever a time where you experience pain, tenderness, or discomfort. Let me know, please.
Okay.
Okay? When I look at you, I want you to make eye contact with me. And I'm going to kind of check your orientation level of consciousness. You do make eye contact appropriately. You follow, so that is a normal finding as well. And can I ask you your name?
Brandon.
Where you're at?
Marion.
What day is it?
Saturday.
And what time is it?
About 10.
Okay. So that tells me your orientation status is normal. You're alert, able to answer questions and follow commands.
Mm-hmm.
So I'm going to go down to your hands. And when I look at his hands, they are pink in color, warm to touch. Between his fingers, there's no infestations. His nails are clean and kept. Capillary refill is within 3 seconds, so it's normal. On the palm of his hand, I see no rashes or lesions or masses or any areas of concern. So I'm just going to have you put them there. Also, while we're here with your hands, I want you, can you move your fingers? Make a fist. Okay, you can put them down. I was just checking your range of motion. So look at me straight. Thank you. So when I'm looking at your head, I'm going to kind of palpate your cranium, your scalp. And I see no lesions, or I feel no masses or nodules or any areas of concern. I see no lesions or rashes. Any pain or tenderness when I touched your scalp?
No.
Okay, your hair is evenly distributed. It is brown in color. Texture is coarse. So therefore, that is also a normal finding. I'm going to put my hands here, and I want you to open your mouth a couple times, and then side to side. And basically, I feel no crepitus, and I'm just testing for TMJ. And you do not have that, so that is also a normal finding. Okay, I'm gonna do the masseter muscle test, which is basically testing your cranial nerve number 5. And so push down. Okay, push down. All right, thank you. That is appropriate finding. And also, while I'm here, I'm gonna feel your temporal artery, and it is pounding, and it's a 3 over 4. So that is also a normal finding. And back to your head, your face and your hands. When we look at your facial features, and everything's even and distributed, so it is a normal finding. Let me double check and make sure I got everything. The one thing I did forget, which I will do it now, is can I have you puff your cheeks out? Okay. Smile. Frown. Clench your eyes. And that's cranial nerve 5 and 7, and they are intact. So now we will move on and go down to your eyes. With your eyes, I just want you to know, looking at your eyes, they look even, symmetrical. I see no problems with my naked eye. As I'm going to inspect your eyebrows are even and on both sides and distributed hair-wise. Your lids are in working fashion, and I see no problems with them. Your eyelashes are intact, even on both sides, and your conjunctiva is intact, even on both sides, and even. I'm going to pull your eye down. Your mucosa is pink, and so that would indicate a normal finding. If it was pale or white or pale pink, we might indicate some anemia, but you do not have that. I'm also going to look at your sclera, which is the white part of your eye. It is normal color, white. If it was a little yellow, we would maybe have to, look at maybe some jaundice. You do not have that. Jaundice is sometimes from liver disease or liver problems. But your sclera is white, and it's a normal finding. Okay. Going forward, your pupils, your iris, everything looks new, everything looks normal. Normal findings, normal shape, normal size. You're following me as I'm talking here with my hands. And so now what I want to do is I want to do a couple eye tests. Are you okay with that?
Yeah.
Okay. Let me see how I want to do this. Let me have you follow this. Okay, I'm just going to cover this eye. And I want you to tell me when you see this.
Yeah. 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 Yeah.
Okay, and that's confrontation test, and that is cranial nerve number 2. And basically that just tells us, because your eyes kind of go in a cone, and so that tells your field of vision. So next, I want to do the 6 gazes and to test your eye muscles. I want you to just follow the tip of this.
Okay.
Okay, and that just shows us that your muscles are working. And also that is a normal finding. Okay, I don't know why I put that down. We're going to do another test, and this is the cover test. And what I'm going to do is I'm going to place this over your eye, and then I'm going to take it off, and then I'll tell you. I want you to focus on me. Okay, that just tells me there was no reflex in this eye. That means your eyes are aligned. And so therefore, that is also a normal finding. That was the cover test. This is the accommodation test. So I'm going to actually have you follow this, and I'm going to take it to your nose. And I want you to have your eyes follow it. Okay? Okay. And that just means your eyes converge and follow this to your nose, and that is cranial nerves 3, 4, and 6, which is actually a normal response. So now I'm going to test your corneal reflex with the light. So I want you to just kind of watch over there to the wall.
Okay.
And what I'm going to do is I'm going to shine a light in the mid portion of in the mid face, and that way it's going to be equally in each eye. And what I see is a reflection and reflection, which is a normal finding. So let's do that again. Reflection, reflection. So that is a normal finding. So now, there we go. I'm going to do direct and consensual light, and I'm going to check your pupils. Your pupils will constrict with light. That's a normal finding and a normal reaction. Okay, so I'm going to place this over your eye. I'm going to go direct in front, and your eye reacts. Your pupil reacts and constricts. I'm going to go from the side. Pupil constricts. Pupil constricts. Also, I'm going to look to the side of your eye, and I see no abnormalities or anything, and the structures look shiny and smooth. When we look at constriction of your pupil, we grade it by this number, and yours is about a 4 millimeter, and that is also a very standard thing. So that's cranial nerves 2 and 3 that are working, and that's 4 millimeters. With that being said, you've kind of passed all the eye tests, so therefore that is also what we want to see. That is a normal finding, so we will go from there. The other thing that I didn't do, which I forgot, but I'll go back and do it now, is your vertebral fissure, which is the opening of your eyes. Both of yours are open evenly. There's no slanting, and that is a normal finding as well. So now we're going to go to your ears, which I can put this down. And just looking at your ears are pink in color, warm to touch. I see no signs of any kind of trauma, no visible signs of injury or rashes or lesions. Have you had problems with your ears ever?
No.
Okay. So just palpating them, any tenderness or pain or anything?
No.
Okay. Now, if you was at a doctor's office and we had an instrument, we would actually look in your ear and see your ear canal, your tympanic membrane, all the parts of your ear, your structures, and your parasternal and flacida, your all the structures of your ear to make sure there was no infection, lesions, or abnormalities. Okay. But since we're here, we're going to just kind of look externally. When I pull your ear up and back, if I was going to look in it, does that hurt or have any tenderness? Because you're up and back. Okay. All right. Now, also the other thing, if I had an audiometer, it's called a pure tone. I would probably put that in your ear, and then you'd have a series of beeps, and you'd have to tell me when you hear them. And we do them on both sides, and I also test your hearing. Okay. Now I'm going to do something that's called a whisper test, and that is also will test your hearing. So I'm going to repeat a series of words over here, and same thing over here, and I want you to tell me them back.
Blue. Red. Yellow. The sky is blue.
Okay, so and that sounded even on both sides?
Yeah.
Okay, and that's cranial nerve number 8 working.
Okay.
And I think we're done with the ears. So we're going to move on to the nose. Now on the nose, just looking at you, it looks even with your face, symmetrical. Skin color is pink. Skin temperature is warm to touch. I'm going to palpate it. No deviated septum. Any problem breathing out of your nose ever? Can you close one ear off?
Oh.
And breathe at the other side? Do the same thing with the other side. Okay. Now that basically, okay, you're done. So that basically just tells me both ears are patent. Now, if I had a light and an instrument to look up there, I would look at your turbinates, your mucous membranes, see if you had any lesions or any signs of infection, and that kind of thing.
Okay.
The other thing that I would do is, just kind of do a general exam. But however, just from looking at you and your nose, you appear to be very, healthy, and I don't see any problems with your nose. Now, I'm going to do a test. Are you okay with the test?
Yeah.
And what I'm going to do is I'm going to have you close your eyes. Not yet. and then I want to have you smell something. Is that okay with you?
Yeah.
Okay. Okay, now close your eyes. Should I have you smell something?
That's coffee.
Okay, and that's cranial nerve number 1, and that means it's intact. Now I am going to back up here. Since we're at your nose, and I kind of forgot before, I'm going to feel your sinuses, your frontal and your maxillary sinuses. Any pain or tenderness?
Mm-hmm.
No.
No.
Any history of sinus problems?
No.
No. Okay. All right, so I don't see any kind of problem there, and that's a normal finding. Also, I'm going to feel your mastoid process by your ear, which we didn't do, which we'll do now, and it is present and intact, which is also a normal finding. Okay, so now moving on. This is is a portion of it that I'm going to get some gloves on because it's your mouth and your throat. So
Okay.
we're going to look, and so I'm going to have to stick my hand in your mouth, or my fingers in your mouth, and kind of look around. Just want to let you know. But first, starting off, just from looking at your lips, they're symmetrical, they're even, there's no drooping, there's no problems there. You open your mouth without any problem, and your lips move up and down just fine. So I'm going to use my pen light, and I'm going to look in here. I'm just going to observe, I'm not doing anything else. Okay, so just looking in here, your gums and your oral mucosa is pink. Open up a little bit. I don't see any redness or any lesions or anything of that. The floor of your mouth is pink and moist. Your tongue is smooth on the bottom. It's a little textured on the top, which is expected. Inside your cheek area, your buccal area, it is pink and moist, no lesions. Can I have you just open your mouth a little wider and stick your tongue out a little bit? Your uvula, can you swallow? Moves up and down. Your tonsils are present. Hold on. About a grade 2, and they're present. Now, your teeth is clean and they're brushed. And so, hold on. I need to look down. I'm going to do an overall look in your mouth. Hard and soft palate is present. Okay. Now, I'm going to have you do a gag reflex.
Okay.
Are you okay with that?
Yeah.
Okay. Okay, yeah, pretty good. That's cranial nerve 9 and 10. Okay, and now the other thing, can you stick your tongue out? Move it around. Okay, and that's cranial nerve 12. Now the other thing, before we do our taste test, because we got to do a taste test, I'm just going to look around again. Okay, so I see no roof of the mouth is fine, no lesions, no signs of infection, gums are good. Teeth are present, brushed, and intact. Tongue is intact, smooth on bottom, rougher on top, which is a normal finding. Gums are pink, and any swallowing or any kind of swallowing or chewing problems?
No.
No mouth infections or any kind of tooth decay or anything of that nature?
No.
Okay, and you still have your tonsils, yes?
Yes.
Okay. Because you never had tonsillitis or anything?
No.
Okay, well, I seen your tonsils. I just wanted to make sure. Okay, now I want you to stick out your tongue, and I want you to have you tell me sweet or salty
Okay.
when I put this on your tongue.
Salty.
You need a minute to...
No, we're good.
No.
Sweet.
Okay, and that is cranial nerve number 7. And that basically just tells us that, you know, that nerves are working. You're able to identify and recognize what you're tasting.
Okay.
All right. So everything in your mouth looks good. I mean, I don't see any, you know, signs of concern or anything of that nature. Now let me double check and make sure we got everything. Okay. Now I'm going to take my gloves off, and I am going to actually sanitize my hands since I was playing around in your mouth. And we are going to move on to your neck. And with your neck, it does look symmetrical. It looks even with your body. I'm going to just feel around for any lesion or for any nodules or masses that I feel, and I do not feel any. Your thyroid gland is right here, and it's a butterfly shaped, and I'm going to palpate it while I'm here. And I don't feel any nodules. And then your trachea, can you swallow? I don't feel any deviation of your trachea. And while we're here, we're going to go ahead and check your lymph nodes on your neck. And I don't feel anything with your cervical chains. Okay, and your subclavicular, just relax. Subclavicular nodes, I don't feel anything. Your preauricle, postauricle, tonsillary, submandible, submental, and then your occipital. I don't feel any nodes, so therefore, if you had nodes that was enlarged, that might be something we have to look into. But that's all within normal findings. The other thing, I don't see any JVD. I don't see any distension of the neck. Also on your neck, your collar is pink, skin is warm to touch, hair distribution is evenly from your chin down, which that is a normal finding as well. The other thing, I'm going to listen to your carotid artery once I pulsate it. And I feel it pulsating, which is about a 3 or 4. But I'm going to listen with the bell of my stethoscope. Okay. No bruits heard, so that is a normal finding. So therefore we are good. If you can give me a shoulder shrug. Okay, and that's cranial nerve number 11. All right, so with your neck, let's just do a recap. Your lymph nodes are all intact and good, no problems there. Your thyroid, which is the butterfly-shaped gland there, is intact, no nodules felt. You don't have a deviated trachea. You swallow normally, and no JVD. Your carotid artery, carotid pulse is normal and bounding, and no bruits heard at your carotid. So now I want you to have you turn around, because we're going to do your chest, your anterior chest, and I'm going to take your shirt off, if you can. Now pull your pants up. I'm going to look over here for a second. Okay, when we look at his chest, his anterior chest, I'm just going to, skin color is pink. He does have some pimples. Skin temperature is warm to touch. He does have some hair distribution around here. His thoracic cage is in line. His spinal processes seem to be good. No tenderness or anything as I touch this or press on it.
No.
Okay, I'm going to palpate his back. No tenderness or anything?
No.
And as I watch the rise and fall of his respiration, it is about 3 to 5, and that's the diaphragmatic excursion. And you can see it rise and fall. And so that is also a normal finding as well. The other thing is his thoracic cage is normal and it is well defined for his development. Now I'm going to also listen to his lung fields. But before I do that, I'm going to do what they call tactile fremitus. And basically what that is, I'm going to have him repeat a number, and I'm going to test it as I go down. And the further away you get from the larynx, the more distance it should become, the vibration that you feel. And basically that indicates if there's any, if that was a positive, where it did not become distant or was a problem, then that might be a problem for underlying lung disorder other than what we are testing or seeing. Okay, so when I put my ice, I'm going to say 99.
99. 99. 99. 99.
Okay, and that is normal. That's a normal finding. It did decrease with the further we got from the larynx. Now I'm going to percuss over his 4 fields. And that is a resonant sound, which is also a normal finding when you're doing over soft tissues and lung fields. So now I'm going to listen. Deep breath. Okay, so listening to his lung fields, there is no congestion or it's all clear. I did also listen to the top of his lung or the apex, however you want to say it. And there's no adventitious sounds other than his abnormal respiration. And again, to kind of recap, his skin is warm, skin is warm, color is pink. He does have some freckles and some pimples. Hair distribution is normal for a male. His spinal processes are intact, no problems there, no tenderness, no masses or nodules felt on palpation. His respiration cycles are normal, even. His expansion is normal and even. 3 to 5, his diaphragmatic excursion. And his thoracic system or his thoracic structure is intact. I palpated his upper thoracic cage, no tenderness. I percussed and I listened to his breath sounds. Now I'm going to check his CVA tenderness or his costovertebral tenderness. And what it is, you basically have to kind of have a roadmap. It's kind of like this. And so that's what you test. I'm gonna kind of give you a soft punch. If it hurts, please let me know.
No. 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 No.
Now, if he would have tenderness or pain, that would be something we'd have to let the physician know, because that would be an indication that there's underlying kidney issue or kidney infection or a disease process going on. And basically, you just make a road map. It's the angle, as it angles down, and then where the kidneys are placed. So I think, all in all, with all that being said, his anterior chest is intact and no problems. So you can go ahead and turn around. Okay, so also now that you're facing me, we're gonna do your chest. And actually, this is your posterior chest, your anterior chest, but I said it wrong. But that's posterior chest, anterior chest. But looking at you, I do want to put your arms down. That's normal. That's normal. I do want to say your shoulders and everything are in line. They're even with your body. They're symmetrical. So that's one thing I wanted to include. But looking at your chest, again, skin color is pink. It's warm to touch. Hair distribution is normal for a male. So now I'm going to do tactile fremitus again. The same thing I did on back. I'm going to have you repeat 99.
99. 99. 99.
And again, that is normal finding. It dissipates with the further away we get from the larynx. So now, I'm going to kind of palpate. No problems? Nothing hurting?
No.
Okay. So I'm going to listen to your lung sounds. So deep breath. And this your lateral. I'm going to listen to this side again. Okay. And all breath sounds are clear, no adventitious sounds that I heard. And so that is all normal. Now moving into your heart region, your pericardium. I don't see any visible pulsations. And I'm going to feel for any heaves or lifts. Okay. Now I'm going to feel for your apical impulse. And that's the 5th midclavicular and the 5th intercostal. I do feel a tapping. It's about a 2. And that is also a normal finding. So just a recap. Your skin's warm to touch. Your color is pink. Hair distribution is normal. I don't see any pulsations. I did not feel any lifts. Your apical impulse is a 2 at the 5th intercostal midclavicular line. And all your lung sounds are clear, so no problems there. So now, and your shoulders and everything, your shoulders and your arms and upper extremities are even and symmetrical with your body. Okay, so now I'm going to listen to your chest, but I want to listen to it twice.
Okay.
Once with my diaphragm and once with the bell.
Okay.
Okay, so it may take a minute.
No, that's fine.
So let's listen to with the bell. Okay, we're going to start with the aortic. Pulmononic. Erb's point. Tricuspid. Mitral. Now with the bell. 2nd intercostal right. 2nd intercostal left. 3rd intercostal right sternal border. 4th intercostal left sternal border, or right sternal border, I mean. And 5th intercostal midclavicular left. Okay. S1 and S2 was heard. No extra murmurs or any kind of other heart tones noted. And so that is all a normal finding as well.
Okay.
Have you ever had a history of chest pain or any heart disease or anything of that nature?
No.
Okay. Alrighty. Well, now we can move on because I think we have got everything there. And we're going to look at your upper extremities. Your upper extremities are, again, your skin color is normal, pink. And then temperature is warm to touch. I'm going to have you do some range of motion. I'm going to put your arms up, down, elbows, out. And then put your arms down, up. Okay, remove your fingers, wrist, up and down, side to side, and thumbs. And then I want you to roll your shoulders. Okay, so with all that being said, your upper extremities are, intact and full range of motion noted. Muscle strength seems good. Okay, so now I'm going to check your epitrochlear nodes. Okay, and your axillary nodes. Okay, and I don't feel any, which is a normal finding. If they was enlarged or, we felt something, we might say something to the doctor, but that is a normal finding, so you don't have to worry about that. Now I'm going to feel for your brachial pulse. Your radial pulse. And your ulnar. And radial is thumb side, ulnar is hand side. And they're all about a grade of 4 and they're all bounding. Let me double check over here. And as I said again earlier, we'll say it again because I've already mentioned it, that there you have no JVD, which is also a good thing. Okay, that's a normal finding. If you had JVD, we might have to say something to the doctor and have further evaluation. Okay?
Okay.
Now we are going to go to the abdomen. So if you want to lay down.
Okay.
If you want to lay down, we will kind of look and see what we got. Okay, first of all, when he lays down, his abdomen is even, symmetrical. His umbilicus is midline. It's normal contour. Hair distribution is normal for a male. Skin color is pink. No rashes or lesions other than a couple of stretch marks. Warm to touch. So I'm going to listen to your vowel sounds in 4 quadrants. And they are all active. But while I'm here, I'm also going to listen to your aortic, renal, and your iliac. And no bruise hurt. Now I'm gonna just put my hand down here. I'll try not to get too up and close personal. And I don't feel any inguinal nodes, which is a normal finding. If we did feel them, then that'd be something we'd have to say to the doctor. And then your femoral is bounding in about a 3 or 4. And so now we're gonna come back to the abdomen. I'm gonna lightly palpate. Any tenderness or anything?
No.
Okay. So now I'm going to do some deep palpation. And when I do that, I'm going to see if we can find the spleen, or the liver, which you might be able to feel the edge of it a little bit, which I think that's what that is. And then let me see, the spleen, can't really feel. And then let me see the kidney. Can't really feel that either, which of that is a normal finding, so you shouldn't be able to feel them. And coming back to this, I'm going to do some percussion on your 4 fields here. And what you're listening to is tympani, and basically that just means it's over air-filled bowel loops, that kind of thing, so that's what you're going to hear. And then usually with the light, I don't see any visible pulsations, but with the light, sometimes you can see your aorta. Yeah, right there. It will move. Now the other thing, I want you to relax. I'm going to test your abdominal reflex. Okay, that's positive. And that is, because when I do that, you can see it. You can see it, kind of the muscles move a little bit. And okay, so now I want you to do like a setup, checking for a hernia. Again. Okay, so I see no bulging or anything that would indicate a hernia. So at this point, so overall, your abdomen is good, or is normal. I don't see any abnormalities. I don't see any areas of concern. Everything checked out okay. Any history of stomach or bowel problems or anything?
No.
No pain or discomfort ever in your abdomen?
No.
Okay. All right. So I think at this point you can set up. Go ahead and set up. And yes, you can put on your shirt. So what you do now, I'm going to look over here. So now we're going to move to your lower extremities. First of all, I want to note his lower extremities are warm to touch, color is pink, hair distribution is even and on both legs. I see no varicose veins. I see no tibial edema. His feet and everything look normal. Can you scoot back on the table so I can demonstrate? I'm going to look at his feet. His toes have no infestations. His calf refill is normal. His feet are clean. Nails are short and clean. And I don't see any areas of concern. So if you want to scoot back forward. I'm also going to check your popliteal. Okay. Dorsalis pedis. And your tibial. Posterior tibial. And they're all bounding in about a 3. The other thing that I'm going to have you do, I want to see if you can do the duck walk.
Yeah.
So if you can kind of go right there, and I'll move the camera so they can see you. Just go right there. No, wrong direction. Why is it looking at me? Okay, sorry, got a little confused. But anyway, go ahead and do the duck walk if you can. Walk across here. Okay, that's fine. And can you go back there and walk on your heels?
On my heels.
And then go back, and then walk on your feet, or your toes, I mean.
The toes.
Yeah. And then if you can do knee bends, shallow knee bends. Okay, and then if you can you move go back, frontwards, side to side. No problems with your spine? Okay.
No.
Alrighty, so you can sit down. So that just tells me that your muscle strength is very good in your hips, your knees, ankles, and feet. It's a +5 on muscle. You are very strong and very, that's adequate finding. Also, I had you move around your back and your spine to make sure you have full range of motion of that, and that you do as well. The other thing is your knee lifts, and you're walking on your toes and your heels. Shows all your joints, are working as well, and them are normal findings as well. Okay, let me. Okay. The last thing that I forgot that I'll have you do now is, can you touch your finger to your nose? Okay, then bring them both. Okay, alrighty, and that's just range of motion and making sure you can do that. Okay, now we're at our neurological portion. And so now I want you to stand up. Are you okay with doing a couple tests?
Yeah.
Okay, I want you to stand up, feet close together.
Okay.
And I want you to open your eyes, look straight, and
Okay.
I want you to stand there for 5 to 10 seconds. Now I want you to close your eyes. Okay, all right, go ahead and sit down. That is the Romberg, and that was basically what I'm watching to see if you sway. That way your position is good, your sense of position is good, you're good. So now we're going to do a position test, and I want you to look at me.
Okay.
And I'm just going to explain this to you. I'm going to take your hand, and what I'm going to do, I'm going to move your fingers up or down. I want you to close your eyes, and I'm going to ask you what I'm doing.
Okay.
Go ahead.
Down. Down. Up. Up. Down.
Okay, very good. You passed that test. So the position test, basically, you got to close your eyes and make sure you know what I'm doing.
Okay.
Okay. The next test would be the. Let me look. I forgot. The graphithesia, and basically what I'm going to do is I'm going to write something in your hand, and I want you to tell me what it is.
Okay. 9. 9. 9.
Okay, very good. Now the next thing it's called stereognosis, or I can never say that word, but it is basically I'm going to put something in your hand, and I want you to tell me what it is.
Okay.
So close your eyes. Okay, tell me what that is.
That is a paper clip.
Okay, very good, very good, very good. So, with that being said, most of your neurological tests we have passed. I need you to place your hands right here and just do this. And that's rapid movement. And then I need you to place your shin and on the opposite, off your foot on the opposite, and go down your shin. The other way too.
Same way.
Same way. Okay, so that just tells me your neurological system is working. Your brain's telling everything what to do. Your muscles and everything is working together. Okay?
Okay.
Now, we're almost done here. And for our last test, I'm going to test sensation. And so basically, I want you to close your eyes. I'm going to touch your cheek, your arms, your legs, your feet, and we're going to go through sensations. So I want you to tell me if it's a prick or a sharp or soft.
Soft. Sharp. Soft. Soft. Sharp. Soft. Sharp. Soft. Sharp.
Okay, can you scoot back on the table?
Yeah.
Okay, where they can see. Close your eyes.
Okay. Sharp. Soft. Soft. Sharp.
Now, sometimes if you're diabetic, we would also do some tests like that to see if you feel anything, because sometimes if you have neuropathy, you're not always going to feel.
Okay.
So that's a good test to always have. Okay, so now, if I had tuning forks, the other thing I would do is I would activate them. I would click them together, activate it. I would put them to a bony prominence, and then I would stop them, and I would ask you when you stop feeling the vibration.
Oh.
And that would tell us about sensation and vibration. That way you could answer that correctly.
Okay.
Okay? So now, I think we're almost to our last thing. I'm going to use this just to demonstrate. We're going to do deep tendon reflexes. And basically what you would do, which I'm going to improvise, your bicep, you would find the tendon, you would hit, and you would see the muscle move. And that's what you're looking for. Same thing with your elbow, your tricep. You see the muscle move. And then your brachial dorsalis, see the muscle move. Okay? Okay, then we're going to go down here to your knee. Just relax your knee. And same thing. We're going to see a positive reflex. And then Achilles tendon, we're going to do the same thing. Okay? So I want you to move back. And then our next reflex is okay, his toes went downward, and that is a normal finding, and that is what it should be. So let me double check over here. Okay. Now I believe we have completed everything, and I believe that you checked out very good in your head to toe. I don't see any areas of concern, and I do want to thank you for doing this with me, and I appreciate your time and effort. And this concludes my head to toe. Thank you.